All right, I believe we are live. Welcome everyone. I cannot believe this is the last week of Migraine Headache Awareness Month, which also means June is almost over. Isn't that insane?
It
I,
is.
I can't even believe it. So I am so excited to have joining me today Dr. Andrea Harriott. And Dr. Harriott, will you introduce yourself to the folks watching?
Sure. I'm Dr. Harriott. I am a headache medicine specialist and a vascular neurologist. So I currently practice at Massachusetts General Hospital or Mass General Brigham. Uh, and I am also a clinician researcher as well, which means that I spend part of my time seeing patients and I spend part of my time doing basic science research. I have a PhD in neuroscience, so some of my time I also spend investigating mechanisms of migraine.
As you're talking, I'm sitting thinking, I clearly don't manage my day well. You are accomplishing so much and doing so many different things. It's just mind blowing. So thank you for taking the time. And she's also on our board, which we're just so honored in her spare time, right? So today we're going to be talking about science and technology. And we know that people who watch go, well, there's no cure, or is there ever going to be a cure, or what can we expect? But I think it's you have an interesting perspective to share. Like, what are you most excited about right now in scientific advancement for migraine patients?
Well, let me first say that I really want to thank you for inviting me to this forum, and it really is a highlight for me to really be able to share what I love to do, which is science, and to integrate patient care with science. This really is the highlight of what I do every single
Well, you
day.
take that as an open invitation anytime.
So really on the heels of we're really on the heels of our 67th annual scientific meeting of the American Headache Society, and we shared so much wonderful science at that meeting. So there's really a lot to be excited about. Um, and there's so much that I am personally excited about. One of the things that I'm excited about is AI or machine learning algorithm-based approaches to understanding the risks of cardiovascular and cerebrovascular disease in the migraine population. We're now learning so much about how AI can be used as a tool to understand how risk factors like atrial fibrillation and other risk factors can be identified early on in the migraine patient population. We're understanding more and more with partnerships about the Migraine and Stroke Association as well. And that will really help us in being able to advance care in the migraine population to increase brain health, reduce the cardiovascular risk burden and the stroke burden in our patient population. There are a whole group of folks that are working really tirelessly on understanding the disease burden in various patient populations, especially the ongoing impact and how we can transform headache medicine care for patients and their families in underserved populations. We have to continue to get care where it's needed. And so there are a lot of people working on that. Um, in the At the AHS, there were a number of investigators that also talked about sleep and migraine, and we also know that there is an association between sleep, circadian biorhythms, and all of that, and migraine. And so there's a lot of exciting science that's going into that. One of my dear colleagues and a really great investigator, Dr. Betsy Sang, is doing exciting work in cognition and cognitive tasks
Hmm.
and how they may trigger headache. I thought that this was actually really important because I have heard plenty of my patients say that when they perform a lot of cognitive tasks, when they're doing a lot of things that cause them to think a lot, that can trigger their headache. And here is a wonderful investigator that's actually buttressing a lot of what our patients are saying by putting forth that research to demonstrate that cognitive tasks may actually exacerbate or trigger headache.
That's amazing. That's amazing. One thing people ask me is, what is the American Migraine Foundation doing with research? And I think one of the things I don't think people realize is that we're constantly hearing the patient voice. You all are constantly hearing the patient voice, and people may not even realize their voice is being heard. Would you say that's accurate? Like, I mean, we relate stuff to you guys. You guys hear stuff from the patients. How important, I guess, are those voices to drive research?
They're actually key, right? So when we hear what patients are experiencing, it's how we move science, right? The
Yeah.
patient has to be at the center of everything that we do, whether it's what patients report as what they're experiencing during their migraine or what's most bothersome to them in terms of a symptom. All of that has to be center in our science, whether it's clinical research or basic science research. If we're going to investigate a mechanism, we want to investigate mechanisms that are most bothersome. So, why does a particular symptom happen? We want that symptom to be the symptom that's most bothersome for the patient.
Yeah.
Uh, if
Yeah.
we're going to target something in terms of a treatment, we want that treatment to target a symptom most bothersome for the patient. So, absolutely, what patients say to us, those are the things that we want to understand, and those are the things that we want to be central to the research that we're doing.
I love that. I think one of the things that was a takeaway at American Headache Society last week too was how often people are putting the headache itself lower down on the bothersome symptom. And there's so many other symptoms that people are going, oh, I didn't know that brain fog could be migraine. I didn't realize the cognitive pieces are migraine. And you just played into that so nicely because I think that's a misnomer that people have. So that you're just replaying what I heard there, that those symptoms are important to share with your doctor. And if your doctor's not clear what migraine really can look like, that's where we're a great resource for patients. American Headache Society is a great resource for the clinicians. Like it brings all these pieces together. I mean, is that a fair assessment?
Absolutely. I mean, we often say that it's more than just a headache, and it absolutely is. And looking at the breadth of symptoms and how it impacts the patient holistically, I think is part of what we're trying to do from a research perspective.
Yeah, yeah, I love that. Are there promising biomarkers or imaging techniques that could revolutionize migraine diagnosis or monitoring? And you may want to describe what biomarkers are, because I want to make sure patients aren't watching and going, "Ah, you lost me at biomarkers. What are we talking about?" So, can you describe what that is?
Yeah, so biomarkers, I think that's really a biomarker is really a broad term that really describes a particular a laboratory test or imaging test um, uh, that allows us to be able to track the disease itself or how someone responds to a particular treatment. So, for example, a biomarker can be a serum test that looks at a particular molecule, or a biomarker could be an imaging test that looks at activation of a particular area of the brain, for example. Or it could be a PET study that looks at how a particular molecule is uptaken in the brain or something of that nature. So you can have imaging biomarkers, you could have serum biomarkers, you could have a host of different biomarkers. It doesn't have to be one particular thing.
Yeah.
But usually it tracks either with the disease or how the disease responds to medications or how the disease changes over time.
Yeah.
So there has been a lot of growing interest in functional imaging studies, mostly in research. It hasn't really, I think, made its way to how we treat patients. It hasn't really made its way to clinical practice, but certainly in the area of research, there has been a lot of interest in functional imaging to examine areas of the brain or neural networks that may be activated, particularly in the early stages of a migraine. And we now have a lot of insight into how a migraine, the process of a migraine attack may begin
which is
because of
huge.
functional imaging studies. There are particular areas in the brain, one area called the hypothalamus and its neural networks that appear to be activated at the very, very beginning stages of a migraine attack. And so we're now going in to try to investigate. Many people are now going in to try to investigate how those areas of the brain may work to trigger a migraine attack. Others are looking at genetic biomarkers to assist in helping us understand how the peripheral and central nervous systems speak to one another to generate a migraine. So a lot of the biomarker research, both serum-based genetics and imaging techniques, are really on the research side of things. But hopefully we'll get to the point where at the forefront of clinical practice and clinical care.
So if someone's watching and they maybe have a loved one, a partner, an employer who is like, they're out with this headache all the time. I mean, I just hear it. I hear it in my head. The science and technology that you are seeing in the background really shows us a, it's more than a headache, and B, there's this, just for basic in a basic viewpoint of as a patient who may not understand any of the science, we're seeing that you can see what migraine looks like, right? I mean, this has to be really affirming to someone who's going, people don't believe me. They say it's just a headache, as you alluded to. Do you feel like science really kind of backs up that it's not just a headache? There's science to prove there's more going on. Is that fair to say?
Absolutely. I would say that many people have investigated various neural networks that appear to be active at different phases of a migraine attack. People have looked at volumetric studies and have seen changes in the brain that may occur over time in patients that live with migraine. People have looked at activity in various brain regions on the basic science side to demonstrate how a migraine attack may be generated. People that are interested in migraine with aura, for example, have investigated how there may be alterations in brain activity in the cortex, the very surface of the brain that may generate the symptoms of aura, for example. And so we know a lot about the science and understand that this is a disease process of neural networks and how they speak to one another. And it certainly is more than just a headache.
I think that's so affirming. I can say that so many patients I've spoken with say that's one of their biggest barriers is A, they're dealing with the pain and the things, the symptomology, then B, they're dealing with on the social side of people not believing them. And obviously, I actually changed my backdrop today because we've heard this, so many people have said this has resonated with them that migraine is invisible, but I am visible and my reality is visible. And so what you're saying is also just so validating, I think, for people watching. Um, are there where, we talk about people don't always want to take medication. Are there technologies you get excited about, like wearables or therapeutics that are don't contain medicine, that if someone's watching, and we certainly don't promote a particular one, but are there any ones that you're like, there are great wearables that you are seeing they're effective with patients?
So that's an absolute excellent question. So the first thing that I would say is the patient clinician partnership is really important, right? And clinicians have to take into account, what patients want in terms of how they want to shape their therapeutic how they want to shape their therapy. Absolutely, there are devices that have evidence for the treatment of migraine and can be used for abortive and preventive treatment of migraine. And so in patients that do not want to be started on injectable or oral medications, devices can be used. Also, biobehavioral therapies can be used as well that have demonstrated efficacy for the treatment of migraine. And so there are a host of non-medication based therapies that can be provided for patients that are effective and provide hope to reduce migraine frequency.
I love that. And we'll make sure to put in the comments. We have a device corner on our website that has some great devices that are showing promising results from the patient perspective and how that's making them feel. So we'll certainly share that as well. If you could fast forward 10 years with your scientific hat on, what do you hope science and technology will have made possible for patients living with migraine?
Yeah, so this is really a great question, because it really speaks to the horizon, right? And what we hope for the future. And for this, for me, I feel like this not only speaks to what I hope for my patients, but also as someone living with migraine, it speaks to what I hope for myself. So today we talk about having robust medications and treatments to decrease migraine days, to produce attack freedom, right? And I think that those are really lofty goals to reduce disability and things like that. And I think that those are wonderful goals for today, right? Having a reduction in the frequency of migraine days per month or things like that. I think those are great goals for today. And those have really generated wonderful treatments, right? We have CGRP antagonists for the treatment of migraine. These are first line medications due to all of the wonderful research of people like Professor Peter Goadsby, who's done a lot of formative research, and we have a lot of pipeline treatments as well that are coming out. But for the next 10 years, I think we can think bigger and more transformative. So instead of thinking about treatments that lessen burden and reduce frequency, I think we can start to think about words that may seem a little bit more scary to the research community,
Mm.
like cure
Mm.
and remission.
Wow.
These are terms that I think we have shied away from a lot in the research space because usually, when a patient comes to you and they say, I want my migraines to go away, the first thing that you tend to say is, well, there is no cure for
Right.
migraine. But in 10 years' time, I wonder if we can get to a point where we say, there's a cure, or there's something that we can do to produce remission.
Hmm.
And this has an increased likelihood of allowing for migraine remission up to 5 years. Can we get to that point where that's our goal? And I think that it will allow us to think about doing research that gets to the underpinning of why migraine happens in the first place.
Wow.
So in 10 years' time, I'm hoping that we're talking more about cure and remission, and that becomes part of our research vocabulary.
Well, that gave me chills. I hope people, I'm sure people watching are going, oh my goodness, that would be amazing. I know we had someone post on social a couple of days ago that they had, I believe it was 30 years they've had migraine and finally found a treatment. And it just brings tears to your eyes, like 30 years. So imagining in 10 years to be able to say to the community, guess what? It's the promise that could be here of the medication that could be really life changing. Well, I could talk to you all day. I was like, I have to go back to my questions because I get off script and I get excited. What do you think that the patient advocacy community and the research community could do to collaborate even better? Because one of the things we want to do is we want to grow our research efforts in partnership with other organizations as well. What's your advice, I guess, to us and those watching who are really active in our community?
Yeah, this is another really great question. I view the advocate as sort of the voice of for the patient, or the voice of the patient. And I think that part of patient advocacy, it helps everyone to better understand the needs of the patient. Um, you spoke before about the idea of being visible. And I think that patient advocacy helps to bring that visibility. People are doing research about stigma and things like that. But I think the role of the patient advocate more now than any other time is really important to bring that visibility out there to everyone. It really centers research onto the needs of the patient. So we need advocacy in terms of research. We need partnership and advocacy in terms of things like prior authorization.
Mm.
We need to bring a message to ensure that there's attention to what the burden and the global health problem of migraine and the enormity of the impact. And also, and importantly in this time, because we're talking about research and technology and scientific advancement, we need advocacy to ensure that there is consistent funding to meet the need of the burden of disease. And so I think that the partnership really needs to be one that raises awareness of the problem so
Mm.
that funding can meet the burden, right? The
Yeah,
funding needs to match the burden. And that's really the only way that advancement continues, is if people understand the needs of the community so that the funding can match the burden. And whether that's, going to Headache on the Hill or being involved in those types of events, whatever you can do to partner with advocacy organizations, the research community, to say that this is an important problem. It's not going to stop being an important problem until we reach a cure and we reach remission and we change the course of this disease.
yeah.
That we're not going to let up until that time.
And it's so big. I cannot believe how much I didn't know before I started this role. I'm actually shocked sometimes when I read all the symptomology and go, how did I not see this everywhere? And so with what 1 in 4 households, I believe is how many houses are affected. So we want people that who are watching who go, wow, what can I do? Share it on your social. Put a sticker on your car. We've got to let people know it's not just a headache because it's affecting our workforce. It affects our life, our marriage, our life with our kids, baseball games, kids' schedules, homework. I mean, there's so many, and it's not just a female disease. So there's so many pieces that I even know coming into this I had not heard. And so thank you for being such a just so willing to go and research this and bringing some game changing things to research. And so thank you. We're so grateful for what with your the heavy load you carry that you're also willing to serve on our with our organization and make sure we're aligning in the right really the right realities for the next 10 years. So that's so important. So Dr. Harriott, thank you. Do you have any words of hope as we close out this segment?
Absolutely. So to everyone, listening, what I would say is there is an absolute huge number of people that are just laser focused on this problem, whose life mission is to bring hope and change and more therapeutic advancements to patients living with migraine, and and that have such a compassion and such a passion for this particular problem, that this is sort of what they live and breathe.
Yeah.
So I do believe that the next 10 years are going to look more promising than the last 10. That we're going to continue to see advancements in this field, and we just have to continue to fight for our patients and for the lives that we want to see them live. And that's free of migraine. And that's what we believe in. And I think that we can have hope in that future. I'm hopeful. That's why I'm here in my lab, even though my backdrop is
It's lovely. Your lab is so lovely. Well,
that's
it's I love it. Last week we went live a couple of times at American Headache Society, and I did that because I wanted people to see that there are people, just what you said, that have committed their work to this. And for those who don't do this, Google Scholar is great to follow because I get the alerts every day of how many papers, how much research is going into migraine. And coming from a rare disease space, you can only dream of that many people working in one disease state. And so I want people to have hope. If you're not feeling well and you're having a really tough day, we've got you. We've got you. That's why I'm here. That's why I'm here advocating on your behalf. And so we want people to know that there's a lot of work happening behind the scenes, and we're just so honored to be part of it. So, Dr. Harriott, thank you. Thank you. Thank you so much. Thank you for your heart, your passion. And I imagine that you are such a fantastic clinician. And just you can just tell by your patience and kindness and drive for this. So thank you for what you're doing for this space too.
Thank you so much, and thank you again for inviting me, and of course, to the
Absolutely.
Migraine Foundation for this wonderful platform.
Thank you. And for those who are watching, don't forget tonight is our State of the Union as we close up the month of June. And we have New York Times bestselling author Tia Williams with us. And I'm afraid most people are probably coming to see her, but that is okay because we love her. For those of you who haven't seen this, Tia is a migraine patient. She is so down to earth and so lovely to talk about the true journey of migraine from her perspective. And now she just finished our second book tour and she's joining us tonight. So we're so excited to have her. We'll put in the chat too how people can join that if they haven't seen that. So Dr. Harriott, thank you. Thank you for all who are joining us today. And we'll be back tonight. All right. Take care, everybody.